we can jump into it. So this is the last. Our schedule has gotten a little bit crazy and kind of lost track of our monthly topics, but this is the last of the monthly topic for hydration. So that was actually supposed to finish in August and then got carried over into September, and now we're at the back end of September. So hopefully get caught up here in the next month, but. Like I said, this is the last one for the topic of hydration. And so specifically along with hydration is the concept of these exercise-associated muscle cramps. So last time we talked about the use of supplemental electrolytes for hydration and when it is or is not appropriate and what it does/does not do. So continuing with that kind of concept of electrolyte imbalance is a common myth with exercise-associated muscle cramps. And, oh, you're dehydrated, that's why you're cramping. Well, when we look at the evidence, that's not actually the case. Most of the time, it's not caused by dehydration, but it's caused by a multitude of different factors, and they're impossible to pin down just as a blanket statement and say everybody cramps because of X. Like, it's much more individual than that. So we'll get into that. Starting with the overview and just kind of the way that I frame my thinking around this is what are exercise-associated muscle cramps? So differentiation from maybe period cramps or maybe some other kind of a either diabetic or some kind of medical condition that's causing some kind of systemic cramps. So exercise-associated muscle cramps pretty much exclusively happens in athletic populations or active populations. And then what causes these exercise-associated muscle cramps? So what are the different risk factors? And then also, are there any steps that we can take to prevent these exercise-associated muscle cramps? And then if you don't prevent them, what do you do when they show up? How do you relieve these cramps once they're there? So what are exercise-associated muscle cramps? This is the commonly cited definition, and this is a pretty modern definition because it was previously included in things such as heat cramps or what was the other one that they called them? Dehydration cramps. I can't remember exactly. There was a lot of different terms that were being thrown around, which were physiologically inaccurate. And so like heat cramps, for example, well, how do you explain a heat cramp when somebody's out there doing an endurance event and it's 20 degrees outside, freezing cold? So it's definitely not heat that's causing this cramp. It's something else. And even core body temp has been shown to not really be correlated with muscle cramping. So it wasn't a temperature issue, but there is something that's causing these cramps. So what are they? The painful, spasmodic, and involuntary contraction of skeletal muscle that occurs during or immediately after exercise. So that definition pretty much it includes everything that's important. It's a painful contraction of skeletal muscle. It's involuntary. They're not telling their muscle to contract. And it's spasmodic. So it's a spasm. It's something that is just happening spontaneously. And it's happening during or immediately following exercise. So any kind of activity, whether that's a football game, a soccer game, a endurance event, whatever it might be, it's happening around this concept of exercise. And so when you look at this lovely guy on the floor drinking his, I don't know what that is, old-fashioned water bottle with a straw. I don't know when they stopped doing those, but they need to get back to it because straws are awesome. But you see this football player on the ground cramping and the leg in the air and somebody's stretching him. So that hasn't really changed in the last 100, 200 years. Like when people cramp, their leg almost instinctively goes up in the air. And somebody else will instinctively come over and push their foot down. And that has been an effective treatment of cramps for a long time. But the anatomy of it. So if you look at the actual physiology of a cramp, what is causing this? And it's not just localized to the muscle. So it's a multifactorial process that involves the spinal cord. And so this has actually been shown in a few different methods, but in human lab studies and also animal studies. It's the spinal cord has the reflex, which basically prevents or inhibits muscle contraction. And when you're fatigued, the spinal cord doesn't send accurate signals back to the muscle fibers. And so you get these spasms of the muscle fibers because the nervous system is sending a signal that says contract. Some people think that it's the electrolyte imbalance that's causing it. So if you don't have calcium, then you can't relax the muscle. But it's actually not a voluntary contraction that then can't relax. It's the involuntary contraction in the first place. You could just be standing there and all of a sudden it's like a gunshot. Your calf just seizes up on you. So it's not an inability to relax. It's an involuntary contraction of the muscle. Any questions so far? Comments?
Yeah, so fair to say that muscle cramps can also definitely be related to central nervous system fatigue. And I
For
would
sure.
think that it's definitely something you can train in the weight room and just through your on-field training as well.
Yeah, so last week we touched on it a little bit, but the paper from Kevin Miller talks about causes, prevention, and treatment of muscle cramps. And that was the 2022 paper that he published. And in that, he gave different letter graded advice for the causes, the treatment, and what they said in terms of prevention. There's very low quality evidence on pretty much anything. The highest quality evidence is to go through an individualized approach where you're going through like a full medical screen. You're taking blood work. You're seeing what they're missing. You're ruling out any kind of systemic condition that could be involved, any kind of underlying condition that would be causing this malfunction of the skeletal muscle. But the second highest quality evidence is that you should be training at a similar intensity and a similar environment to what your game is going to be. So if you are, for example, if you're practicing at night, but then you go out and practice midday, then your temperature is a lot different, right? Like evening is going to be a lot cooler than midday. So that can throw things off. A lot of like soccer teams, for example, youth soccer teams are going to practice at 6 p.m., 7 p.m., but then they go out and play their kickoff at 12 p.m., 1 p.m. So the temperature difference is they're not accustomed or acclimated to that. So your training should match your intensity and your environment for your game. That's a big, pretty high quality evidence that plays a role in muscle cramping.
Awesome. Yeah, that makes a lot of sense.
So, what causes exercise-associated muscle cramps? Again, this is from that Kevin Miller paper that I just referenced, the 2022. And this is the latest model of what causes exercise-associated muscle cramps. And I love how messy this chart is. It's a flow chart, but it's so incredibly complex. You can start anywhere along this puzzle, and you can also follow this puzzle through all the way, and you can just pick one pathway, and you can see how all of these different things are influencing the likelihood that somebody cramps. For example, people used to call them heat cramps. Well, the heat doesn't directly cause muscle cramping. We know that for a fact. If you just go sit outside when it's hot, you don't cramp. You only cramp when you have heat plus the activity. So what does heat do? Well, it leads to increased muscle temperature, which then goes to an increased excitatory afferent activity of the muscle spindle, which then triggers this final common pathway where your altered neuromuscular control at the spinal level increases your alpha motor neuron activity. And then that increases the muscle cell membrane activity, which then leads to the exercise associated muscle cramp. So it's not just the heat, it's all of these mechanistic pathways that happen throughout the human body. Similarly, you can follow that heat pathway up and around the top, and you can go to hypohydration. Okay, well, dehydration causes cramps. Well, not always. But what hypohydration does do is develops muscle fatigue much more quickly. The blood is being pumped at a much slower rate because it's much more viscous. So then you get this increase in muscle fatigue. What does that do? Well, it increases the excitatory afferents and decreases the inhibitory afferents. And then you arrive at that final common pathway. So that is the kind of universal, is that we finally get to this altered neuromuscular control via any one of these factors or all of them combined. And then that results in an increased alpha motor neuron, which is basically your typical nerve that feeds the muscle. So this increased alpha motor neuron telling the muscle to contract, and then that action potential is arriving at the muscle cell membrane, and then that's actually causing the muscle contraction. So big messy pathway with all kinds of different risk factors, but these are what you have to consider when you're talking about what causes exercise associated muscle cramps. A lot of times coaches will just want a simple answer and they say, well, what's causing these cramps? We need to get ahead of this. Okay, well, does every single athlete have a lack of sleep? Does every single athlete have dehydration? Does every single athlete have pain? Does every single athlete have stress? These are all going to be tweaked in slightly different directions, but they're all going to arrive at the same pathway. So in terms of what answer can you give them, it's hard to say. You can't really say a universal or a blanket statement, this is what causes cramps. It's all individualized and it has to be treated as such. So how do you prevent them? Well, similarly, it is very complex and you have to take an individualized approach. Well, if they have a pain problem that's leading to this increased excitability of the nervous system, well, then you have to manage and modify their pain. So if you can modulate pain, then you're going to be less likely to cramp. But there's I think it's a 17 question, a 17 item questionnaire that I don't remember exactly how many items I should, but I think it's 17 items and you have to go through a history and collect 17 different questions for each athlete in order to identify the risk factor. It's basically just risk profiling. So if they have a family history or of some kind of underlying condition, maybe that's playing a role. Maybe it's a hypertension issue. Maybe it's hypotension. Or maybe it's their individual history of muscle cramping and they're just genetically predisposed to frequency of muscle cramping. Whatever it might be, you have to identify the individual risk factors and then treat those risk factors as you would for any kind of medical condition. You have to treat the individual, not the condition or the outcome. And then, like I said earlier, you jumped the gun when you asked the training and acclimatization question, but that was one of the highest quality evidence right behind individualized approach and taking a medical approach to it, where you're asking these history questions and you're actually taking blood draws to then measure out what they may or may not have in their system. The next highest quality evidence is that their training and acclimatization should match the intensity and environment of their games. Comments, questions about any of that?
Do you have any ideas in terms of what markers you would see after examining their blood that could predispose somebody to having more of these kinds of cramps?
The easiest one would be dehydration. You can check their hydration status through their blood. You can check your blood serum for electrolytes and see if they maybe have some kind of electrolyte deficiency, a true electrolyte deficiency, and not just like the theoretical one that everybody talks about. You can see if any kind of maybe it's their plasma has too much protein in it, and maybe they've got some kind of muscle breakdown or muscle wasting that's going on, and that's causing increased muscle fatigue because they're not getting enough protein in their diet. Or maybe it's early onset of like something like rhabdo. So it's hard to say like this is what I would look for. There's all kinds of different blood markers you can look for, but essentially if you just take like a standard blood panel, like you're going to see if they're relatively normal or if they have something that's extremely outlying, and then you go from there and you treat that. So if somebody's low iron, then you treat for low iron. If somebody has I mean, you could even find out like if somebody's like sickle cell, for example, then you can see like, okay, well, their heme's low, or their blood oxygen is low, like their oxygen saturation is low. So it's hard to say, like I said, one thing that we're looking for. But if you take just a standard blood panel, it's going to show you, is this person have anything obvious in their blood that's going wrong that needs to be treated? Could be a vitamin issue, could be macronutrient, could be micronutrient, could be hydration, could be a number of different things.
Mm-hmm. And then if you're not seeing anything abnormal on the blood levels, and maybe you take a look at the other things like the amount of sleep that they're getting, their diet, hydration status, and some of the other things we saw on that chart.
I would probably start there because if there's like obvious and glaring things that are non-invasive, like you don't want to just take a blood draw just because, like, just for the heck of it. Like you want to rule everything else out that's easy. Like, okay, if you slept for 3 hours each night for the last week, that's probably your risk factor. If you have extreme like performance anxiety, so every time you have a game you psych yourself up and you stress yourself out and then you go out there and you cramp early in the game, well, maybe you have some kind of a psychological issue and you can address that prior to taking any kind of a blood sample. So blood work I would save and kind of do as part of like their general physical if you do blood draws, or if it's like you can't get anything through their history, their nutrition, their hydration routine, all of those different things, and you're like, I think that they might have some kind of a, maybe it's low iron, or maybe it's a vitamin deficiency that you're specifically targeting, and you're like, I think this is what it is. Can we get some blood work done and see?
Got it. Yeah, that makes a lot of sense.
So, how do you relieve these cramps once they are there? Stretching is by far the fastest and most backed by research, and also most backed like um, anecdotally. Like again, this goes way, 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 way back, and I think it's a bit instinctive, where people are like, as soon as I feel a cramp, I kick my leg in the opposite direction. If my hamstring's cramping, my leg goes up. If my calf's cramping, I need to push my foot down. So whatever it is, I think it's pretty instinctive. But stretching for sure has been backed by dozens of different studies as an effective treatment to quickly relieve exercise associated muscle cramps. If you can't relieve the cramp by stretching, you don't really need to do anything differently. You keep trying to stretch and keep trying to relax. You can start the hydration process, but that is obviously going to take time to go through the stomach and to then kick throughout the body and to the muscle cells themselves. So hydration won't hurt, but it probably won't help much either, unless it's in the longer term. But if you have some kind of a prolonged muscle cramp where it's becoming a medical risk for things like I said, like rhabdo, where now you're actually causing harm to the muscle or to the body, and you're getting muscle breakdown because it's been contracted for too long, then you might want to send somebody into the hospital to get some kind of IV started. But for the most part, you're going to get relief from just your typical stretching. Consumption of strong flavors is a fairly modern thing. And as you can see in this screenshot from my text with my mom, in 2023, I was actually covering the Gold Cup, and this was Canada versus Cuba. And one of the Canadian guys went down, and I guess the commentator or my mom called it a fall. But obviously we look back at it, he's drinking pickle juice, and this was being treated for muscle cramps. And you can see he's in like the 97th minute. So there's only probably 5 seconds left in the match. But anyway, the physios got called onto the field and they gave him pickle juice. So my mom sends me a screenshot or a picture of the TV and says, what did they give this guy to drink after a fall? And so it was one of those pickle juice shots. And so what seems to happen with that is that the acetic acid inside of things like vinegar, mustard, pickle juice, it's stimulating this transient receptor. So it's basically bypassing the spinal reflex. If you can because it doesn't go through the stomach, it's similar to water. Like you're not drinking the pickle juice and then it's going through the stomach, getting into the muscle and then relieving and relaxing the cramp. What's happening is you're stimulating the nervous system in an opposite direction. And for whatever reason, this physiology is pretty poorly understood. But what seems to happen is we actually activate a different receptor, probably higher up in the spinal cord reflex, that tells the brain, hey, we need to stop this muscle cramp. So whether it's activation or relaxation of a neural pathway, something is happening where there's a blocking of a neurotransmitter or a neural signal going to the brain where it's saying to not cramp, or it's blocking the signal to cramp. So, and the same thing works with this product that's, it's been around for probably 10, maybe 15 years, if I had to guess, called Hot Shot, which is a really like spicy drink, which again, really strong, bold flavor seems to be what does it. And in the case of the hot shot, it's not the vinegar or the acetic acid that's inside of it. It's actually capsaicin, which is a really spicy pepper. And so this is actually the same ingredient that's used in things like Tiger Balm, if you've ever used or smelled Tiger Balm, where it's got that really pungent, kind of warm, spicy smell. That's the capsaicin as the active ingredient. You put that on your skin and your skin tingles because it's such a strong and potent spice. So consumption of strong flavors does seem to relieve cramps to some extent. It's less effective than stretching, but if you're already trying stretching and you're not getting results, then you can also try this. Comments, questions about that?
Yeah, what goes into the return to play decisions when you have an athlete that's cramping up?
I don't think there's necessarily like a protocol that's out there. I think it's a lot more of a collaborative decision. Like at our level, it's kind of a collaborative decision between coaching staff. You know, how many subs do we have left in the game? In most contexts, it's going to be, can they go? Like physically, can they run without triggering another cramp? I think it was the 2013 NBA Finals where LeBron had his infamous cramp in San Antonio. There was like something that happened where the AC went out in the building, and people are conspiracy theorists and say that San Antonio did it on purpose. But regardless, LeBron in like the third quarter started cramping, and they could not get his cramps to relax all the way through the fourth quarter. I mean, they were trying everything. They had ice packs on his legs. They were doing massage. He was stretching. They did like the massage gun. They literally tried everything. Hot packs. You name it, they were on the sideline, and they kept zooming in because it's LeBron. And they were trying everything to get that cramp to relieve, and they could not get him. He would go out. I think he would like feel okay. I relax. Tries to go back out for one more play. As soon as he steps in bounds, bang, cramps again. And so sometimes you just can't get that cramp to relax. And so at that point, if you're out of subs, like in soccer, tell them to do their best. Like sometimes you just manage their position, manage their workload a little bit. If they're walking, maybe they don't cramp, but as soon as they try to sprint, then they cramp again. So maybe you tell them or put them in a position where they don't have to sprint. It's more of a tactical kind of modification than it is a medical modification. There's not necessarily although what I typically see is that after a long duration of a cramp, they're going to have some intense muscle soreness, similar to like if they did a really heavy gym workout. But there's not really an injury risk of muscle cramping that I've seen. I've not seen a single person go from a muscle cramp into being diagnosed with a muscle strain.
Gotcha. So that's helpful. So it's more of a collaborative approach between the coaches, between yourself, and between the athlete, and maybe doing some really gentle sprinting on the sideline to see if they can do something like that before reintroducing them into the game can give you an idea if they can actually return without cramping up again.
Right. Like if sometimes you know your athlete, if you know your history of the guy that you're working with, so you get out to the field, and if he's like always a 70-minute cramper, like every game, 70 minutes, that's his fatigue limit, and his body just says, nope, I'm cramping, then you kind of know, okay, well, this guy's done for the game. Like we can get him up and stretch him all we want. We can give him all the vinegar we want. At the end of the day, he's going to cramp again. Like we know this individual versus sometimes it catches you by surprise and you'll have a cramp from somebody you never expected to see a cramp. And so those you kind of have to feel it out. Does this present as somebody who wants to keep going? Does this present as somebody who's unable to relax that muscle and get going again? Sometimes if they have a really long history of cramping, they'll know themselves and they'll tell you like, no, I'm fine. I just need a quick stretch, but I'm good. Otherwise, sometimes they'll say, no, I'm done. I need to come out. I can't keep going with this cramp. So it's a little bit individual in that regard as well.
Cool. Yeah, that's helpful. I feel like this is something I'd more likely to see at the soccer games coming up this weekend. So I feel like it's helpful to know that.
Yeah, like if you're a neutral AT and you're just there to make sure that nobody dies, as long as they're not having like full body cramping, like bilateral quad, calf, hamstring cramps, as long as they're nothing crazy like that, like most of the time, I would say leave it up to the coaches. See if there's a sub rule, like Because if it's youth soccer, there's usually not a sub limitation unless it's like club soccer or something. So if they have unlimited substitutions, they can do a platoon swap and they can just get as many subs. They can sub him off for 5 minutes, see if he can go. And then as long as you're convinced that he can go out and do everything he needs to do, you can put him back in pretty safely. But if it's more team-based athletic training, so now you're talking about, okay, what's the best thing for my team? How can I influence like my team's ability to win a game? Then you're going to change your thought process a little bit, and you're going to say, okay, well, tactically, is this going to hurt us? And I rely on the coaches for that because I don't know what for example, if I have a center back who cramps, okay, well, what does that do for the other center back, or what does that do for the rest of our back line? What does this do for our midfield? I don't know those answers, and so I have to rely on the coaches to kind of say, if this guy can hobble around on the field for 10 more minutes, do we want to leave him in, or do we want to waste a sub on him? Now you have somebody else who always cramps and they're going to cramp in 5 minutes. Okay, do we waste the only sub we have left and hope and pray that this other guy doesn't cramp? So some of it's just a little bit, I think depends on your scenario or your setting. Like if you're just a neutral AT there to make sure everybody's safe, yeah, I mean, like I would probably never tell a guy like you have to come off the field as long as they're willing to keep going. If their coach is like screaming at them to get up or it'll kill them, that's a different story. If the athlete's like, I think I can try, just let me like walk it off and see, probably going to be okay.
Cool. Yeah, that's helpful advice.
For the literature review for this week, so Gatorade Sports Science Institute has a pretty updated and modern approach on exercise-associated muscle cramping. That publication or that kind of blog post is pretty good. Michigan State Healthcare had a pretty cool, or I guess if you're a nerd like me, it's pretty cool. But NWSL Muscle Cramps Remedy. So they interviewed, or I think they like highlighted 2 NWSL players, and they were pretty big name players, and so they weren't used to cramping. And they tried the product Hot Shot for the first time, and they were describing their experience, and it tastes awful. If you've never had it before, I suggest you try it, but it is nasty stuff. You don't want to drink it. But again, the strong capsaicin does seem to have some effect in terms of relieving muscle cramps. So if your team is NWSL and you have 5 substitutes and you are already out of subs and you have somebody cramp with 10, 15 minutes left in the game, do you take that player off the field and then you play down a man for 10, 15 minutes? Probably not. You're probably better with somebody, even if they're just standing still, at least you have somebody you can pass to, somebody that can stick their foot out and block a pass. You're better off just with them staying on the field as best they can. And so tactically, again, this is where this comes in. If you give them that hot shot, now maybe instead of just standing around and hoping they don't cramp again, now maybe they can walk, or maybe they can jog, or if they could jog before without cramping, maybe now they can run a little bit. So it's just an interesting highlight of the strategy behind kind of relieving these muscle cramps. The media side of things, I kept in the same video from last time. Dr. Kevin Miller, his exercise-associated muscle cramping, hyponatremia, dehydration, and electrolyte loss video. And that video is a really good video just in general. But he highlights literally everything that's wrong with all of these theories and debunks everything physiologically, research. He does a very good job of highlighting the science and the evidence of what does and doesn't work for exercise-associated muscle cramping. Dylan Johnson is a biker on YouTube, a cyclist, and I actually just found his channel while I was putting this presentation together, but he's got a video called The Electrolyte Myth, and it's what causes cramping, and I believe it was how to treat them when they happen. But he does a pretty good job of bringing in different articles. He highlighted actually a couple articles I hadn't read, so good on him. But pretty good research-based approach in terms of discussing like cycling, what the suggestions are for cramping related to that sport. And then physio tutors, I think that Physiopedia does a really good job on a lot of their different stuff, but they had a YouTube video called Muscle Cramp Prevention Based on Science. That was, it's a pretty short video, but also highlights the more modern approach of how to relieve muscle cramps or how to prevent them. The publication review for this week. So this was a little bit less scientifically rigorous study. This was, I believe, from 2008. Pretty old publication, but it's interesting to see this shift in the theory, or this shift in the hypothesis between what is causing these exercise-associated muscle cramping. So this was the first publication that I am aware of where they highlighted this kind of idea that, well, it's probably not actually electrolyte depletion that's causing it, because we aren't depleting any of these major electrolytes, even though we sweat them all out. Sodium, chloride being the two biggest, things like potassium also playing a role. What's another? Magnesium to a much lesser extent. Like we're losing a very small quantity of these things relative to what's in our body. So it's unlikely that they're causing the issue. Similarly with dehydration, we just don't see a lot of dehydration data where it says that if you're dehydrated, it causes cramps. It plays a role, as we said, and it can cause muscle fatigue or earlier onset of muscle fatigue, which then can lead to altered neuromuscular status, which then triggers that muscle cramp. But it's not the dehydration in and of itself. And then, so then they break down the evidence in support of those two, but then they also present this new theory, the altered neuromuscular control hypothesis. So altogether, they had 53 publications included in their references. This, again, I think this was more of a narrative review. They didn't cite like the search terms that they used, or the number of studies that they came across, how many they excluded, and for which reasons they excluded them, as they would in a typical systematic review. But nonetheless, this narrative review had 53 publications in their references, so I can assume that they read through somewhere along the lines of 53 publications for this evidence. In favor of these electrolyte depletion and dehydration hypotheses. Most of them were anecdotal. Most of them are just people that said over time, oh yeah, your electrolytes are definitely depleted. You lose sodium when you sweat, so you need to replace your sodium and then you won't cramp anymore. Or people say you are dehydrated, that's why you cramped. And then people try to hydrate way more. They're drinking like 3 gallons of water, doing the whole bro bottle, carrying around a gallon of milk, and they're trying to drink this much water in a day, and they're very hydrated, but they're still cramping. So they're like, well, maybe I didn't hydrate enough. I mean, I guess my coach told me that I should have hydrated more. I drank my 3 gallons, but I guess it's still not enough. I guess I'll upgrade to 6 gallons tomorrow. So the dehydration hypothesis kind of falls apart. And even more so, they don't really hold that much weight, because why, if you have an electrolyte depletion or a dehydration issue, would you get relief from stretching? It doesn't make any sense that you would have this mechanism of dehydration, but then what does stretching do? Does stretching pull water into the muscle from thin air? Like it doesn't make sense for why stretching would happen. Similar with electrolyte depletion. Why would stretching replenish your electrolyte levels? Of the actual scientific, existing literature, there were 18 case studies that were put out. And so that was the largest body of evidence, is just these case studies. They had 18 individuals who said they cramped because they had some kind of serum deficiency of electrolyte, probably sodium, or it could be chloride, or it could be magnesium. But anyway, so they had these 18 case studies where they said, oh, these people are dehydrated or have electrolyte loss and they cramp, and therefore it's correlated. But these are all just like separated 18 anecdotes, but they're not high quality. Like if you look at levels of evidence, these are very low evidence studies. They only had one case control study. And furthermore, this case control study fell apart when you actually look at the quality of the evidence. So when we look at good evidence, the 4 cohort studies that were put out at this time, again, in 2008, there wasn't a ton of evidence on this, where there is now much more solid body of evidence to support the what is it called? altered neuromuscular control hypothesis. So these four cohort studies that were put out, they were comparing by group. And so basically what they were looking at was, of the crampers and of the non-crampers, what did they have in common? What did they have different? And so their serum levels were pretty much identical. There was nothing statistically significantly different about their hydration status, about any of their electrolytes. And furthermore, they found that these field studies showed that the EMG data, so they took these, I think they were triathlon or maybe marathon runners, and they had them take baseline EMG, and then they also had them take EMG, or no, I think they took the baseline EMG prior to their event. And then when they went out and did the event, their EMG data would show that if they had higher electrical activity prior to the event, they were more likely to cramp. That wouldn't be the case if you had any kind of electrolyte issue or if you had a dehydration issue. It only happens in the fatigue model. So if you're losing this altered neuromuscular control, you have this raised level of stress or this raised level of fatigue. And then as you go do your event, you're more likely to cramp. And so this kind of predictive model had some early success in the literature. Furthermore, they took animal experimental models and they showed that under fatigue, the spinal reflex is more likely to have involuntary contraction of these muscles, skeletal muscles. I don't remember which animal. I think they did it in mice, but I'm not 100% sure. Where they had them do these basically treadmill tests where they had them induce fatigue and then they were more likely to cramp. Similarly, they also had this with humans doing calf fatigue. So they had them doing, I think it was the seated, like isolated calf raises with basically they go until fatigue and then they were more likely to have calf cramping either immediately following or the next day under fatigue, as opposed to anything related. They were given the exact same dosage of electrolyte replenishment. So the case controlled for the electrolyte and for the dehydration. The only thing that was different was the intensity of their training. The training group was more likely to cramp. So it's for sure related to fatigue. Any comments, questions about that before we move on?
No, so I think that helps tie it all together, though. This kind of reinforces what we saw with the first chart, where that final pathway was the altered neuromuscular control, or whatever the wording was. Altered neuromuscular control. And then above that, you have a bunch of different factors where it could be stemming from, but it's almost always impossible to pinpoint, oh, it's coming all from this or it's coming off from that.
Yep.
Cool.
Yeah, for sure. So just to reiterate the summary, what are exercise-associated muscle cramps? They are painful, spasmodic contractions of skeletal muscle. They are involuntary and they happen around exercise. What causes them? There's a multitude of different things. And as you've pointed out, they can result or arrive at the same common pathway, but they all influence one another. It's not necessarily that one or two cause them. It's that they all increase the likelihood or the risk. And the more you raise that kind of threshold, the more likely you are to cramp. How to prevent them? Take the individualized approach. Make sure that you're not missing any obvious risk factors in that chart. So if you can intervene at any obvious risk factors, so for example, lack of sleep, tell them to get more sleep. Does that alleviate their cramps? And then you continue to modify or monitor that history, and you find a game plan that works for that individual. If you try that and it doesn't work, then you go back to the drawing board. Okay, well, what else is a low-hanging fruit? Maybe it's dehydration, maybe it's stress, maybe it's anxiety, whatever it is. But you find these low-hanging fruit and you try. It's kind of trial and error, and then ultimately you can get to the conclusion of doing like a full medical workup where you're doing blood work and everything along those lines. But those are kind of last defense solutions. So how to relieve them once they are there. Stretching works very well. IV is only typically in the case of emergencies. The use of strong flavors, things like capsaicin or vinegar, acetic acid, definitely have an influence on the relaxation process. That will do it for tonight. The next one I'm going to try to do on Saturday. We've actually got the weekend off. So Saturday, we'll try to get a double in this week and get caught back up on the study group kind of pace. And so the next topic for the month is going to be therapeutic interventions. So we'll talk about things like different modalities. We'll talk about massage, different soft tissue practices. We'll talk about hot and cold treatments. And then we'll get into some nitty gritty because one of my biggest what would I call it? Anti-trends or anti-mainstream is the use of ice is not evil, and the mainstream advice is peace and love. So I will definitely rant and rave about my thoughts on the use of cryotherapy.